have seen how the angiography is performed in great detail. Now it is time to understand what next. The most commonly asked question by the relatives, by the caregivers, by the fellow colleagues and even the junior doctors. Now angiography is done, what next? So let's understand how we can address this question. Before we actually discuss what next we want to do with the patient, let's understand what are the immediate precautions what we need to do with the patient, and then what are the decisions we need to take about the management of a patient. Here I am considering the angiography. By angiography I mean a femoral angiography, which we saw in detail in the last video. Definitely there are radial angiographies which are performed through hand, and the femoral angiographies which are performed through the thigh regions. So let's understand what care patient must take after angiography is done. Immediately after angiography, in patient is asked not to move his lower limb for at least 4 hours. After 4 hours, he can slowly stand up and start walking, so that we understand whether there are any hematomas or bleeding at the site of a puncture. Meanwhile, patient is also asked to report if he develops sudden pain at the site of a puncture, if he develops uneasiness, if he develops vomiting and all other things. At sometimes we see, because of the contrast what we give, generally the patients are tend to have some kind of a vomiting or a nausea like sensation. It is advised that patient should not eat or drink anything for at least 2 to 4 hours. After 2 to 4 hours, we can start gradually with the sips of water or liquid, and then after 6 hours patient can have his normal food. So we discussed about this immediate post-operative care for the cases of femoral angiography, the angiography which is performed by the root of thigh. Nowadays we are also performing in good numbers the radial angiographies, where patient get admitted for the angiographies. The angiography is performed through radial artery, and the most important advantage of radial angiography is there are less chances of a hematoma at the puncture site, as well as the patient is in a position to get discharged within 2 to 4 hours after the procedures.